Welcome to part 2 of our webcast interview with U.S. Congressional candidate Jackie Walorski. Respond to this statement. Healthcare should be treated like a public utility, like fire protection or roads or the Fulton County Hospital.
I've never heard that statement, but I can tell you this. In this healthcare concept that these guys passed, we're going to a hospital-centric system where access is going to be limited. And if you're a privately owned, if you're a specialist, if you're a private physician-owned hospital or a private physician-owned clinic, as you get squeezed out of this market, and as this market gets squeezed down to large, centralized, hospital-centric systems, we are never going to get out from underneath this issue of senior citizens having access, people that have health issues and have terminal issues and are having chemotherapy, and the rate of cancer in this country. All we've done with this hospital system is, instead of looking at trying to get out from underneath all this excessive billing through Medicare and Medicaid, two big bankrupt programs. But what I found out is, to understand the healthcare plan, I brought together CEOs from hospitals in the 2nd District, doctors, nurses, put them around as a big advisory council and said, talk to me about healthcare. Talk to me about where you're at. And a lot of these doctors have said to me the same thing that we do in the state of Indiana. If we're looking to make a major shift in this state, we would never make a major shift with blinders on. We would look at other states, and we would never want to reinvent the wheel. We want to see what mistakes did people make, what's working around the country, what's the most economical, what is still patient-centered care or whatever. And what I'm hearing from doctors is this, that there are ways we can reform the system. We don't have to go hospital-centric. We don't have to go where there's going to be access issues and certainly cost issues. But what we can do is use the models that are out there right now that Mayo Clinic have, University of Chicago, Cleveland Clinic, and they've gone and they've literally taken the failure of this country's system and they've instituted in some of our best and brightest places a value system over a volume system. And it's a patient-centered care system. So instead of what we're going to do now, which is going to continue down the path of failure, which is if I have cancer and I walk into my doctor says you need to see a specialist, and I go to 4 different places. I go to an oncologist, I go to a radiation oncologist, and I go to nutritionist, and I go to these 4 places, 4 separate billing, 4 separate schools of thought. Nobody's working together. Nobody's coordinating it. What the big hospitals in this country are doing right now, getting away from that and saving money, saving insurance companies money, saving me money as a patient, is they're going to value care instead of volume care. So when I walk in there today as a cancer patient, then when I walk in the door, all 4 doctors are sitting in the room, and they're coming together on the best school of thought based upon what the patient wants. 1 centralized billing, 1 concept for test, 1 MRI ordered, and not 4 different MRIs ordered. And what that will do, that concept alone would be worth investigating because it would save money. If you couple that with tort reform and then portability of insurance policies and then the transparency of costs where I can shop around, and if I want an MRI and it's $300 here and next door Logansport it's $500, I ought to be able to make that decision. I ought to be able to save myself and my insurance company money. I think the entire model is wrong. But I think there's ways to do it. And I think when I say start over, absolutely, because I think there's things that will work, and I think the American people would buy it. I think they buy into it.
Do you believe global warming is the result of greenhouse gas output? And if so, do you think it's a serious problem?
No.
You've said in no uncertain terms that the cap and trade program, which is designed to limit those emissions, would completely paralyze the state of Indiana. 2 questions. 1, how so? And 2, what would you advocate in its place?
Well, we're sitting on a coal state. And so, we're sitting on some 300 years of coal in southern Indiana, the coal mines, number 1. The way that we've taken this state in recovery from a $1 billion deficit to nearly a $2 billion surplus with no tax increases is we became highly competitive in the state of Indiana. We went out around the country and around the world and said, come and invest your private dollars here in this state. One of the things that we hold up in the state of Indiana as a competitive tool is our low utility rates. We have nuclear power, we have coal-generated power, we have the gamut of power in the state, but we have some of the lowest utility costs in the country. If we are going to stand by and allow taxes and regulation to come into a coal state because we're sitting on natural resources, we're shooting ourselves in the foot. Private investment will stop. We're going to end up having to rely upon the public dole, which is public tax money. And when people are in their houses right now today and they're flipping on their computers for their kids who are in school, and the kid comes home at night and he's doing his homework on his computer, every time he flips a switch or they flip a switch, our utility rates, the estimate is, will have tripled in the state of Indiana because of the fines that we will have because of coal. And yet, we have coal gasification plants in this state, especially in southern Indiana. We ran them out in northern Indiana. $2.5 billion investment just to build them. Most of those jobs start at $75,000 a year. It's the cleanest coal technology we have in the nation, and it's always being refined and being 98.9% clean burning coal. And I guess my statement would be to you, it would be this. I believe that the jobs of the future generation and the way we get people back to work in this district, including the trades, is to get out from underneath the ground what we have as natural resources, and I believe it's in energy jobs. And I believe it's building nuclear power plants in this state, building coal gasification plants in this state, putting the trades to work, building facilities that are billion-dollar investments, and then the starting wages in those places, $65,000 to $75,000 a year. We're doing it now, and I think we ratchet it up in this state. We don't shrink back. We don't run in a corner. We absolutely utilize what's underground. That's our natural resources.
You were licensed to carry a gun, yes?
I co-authored the lifetime handgun permit.
You have a license?
I have a license and a gun.
Are you packing right now?
If it matters to you, yes.
I'm wondering what kind of weapon you carry.
38.
Auto?
Nope. It depends on what day. Today I have a 38.
Is that right?
Yep. And I have a Glock. And I have a Smith. And I have a 9mm. And I have a shotgun. And I have a rifle. And I shoot them all.
Okay. Have you been endorsed by the National Rifle Association?
Not in this race.
How is that? You sound like you're pretty much a gung-ho gun person.
I am, and I don't think they've endorsed for the fall yet. You know, I know they have a rule where they don't endorse outside of incumbents, and so I'm running against an incumbent. If it was an open seat, I'm sure I would. Because I'm facing an incumbent challenger, I don't know if I will or not, but the people of Indiana know that I've probably been the co-sponsor of every piece of gun legislation in 6 years in the state.
Could we go shooting sometime?
Absolutely. I'll take you on.
That. Okay.
Good.
I'm not too bad.
I'm
not
not
saying I'm better. I'm just saying
I'm not saying I'm better. I'm just saying I can take you on.
Your opponent, Donnelly, is among the most conservative, certainly the most conservative Democrats. And when it comes to a number of social issues, he's as conservative as many Republicans. The southern border wall, the right to bear arms, among others. Are you less conservative than Joe Donnelly or more conservative than Joe Donnelly?
I don't think Joe Donnelly's conservative. So I'm not sure who's saying that. If you're saying that as the editor of the Rochester Sentinel, or if you're quoting somebody saying that. But when you are elected as a U.S. congressman, and I took a white paper to him in D.C. and handed it to him that said that the vote on that health care bill will bankrupt this state in 18 months. Not on emotion, not as a Republican to a Democrat, not on rhetoric, on pure fact. And he looks me in the eye in August of last year and says, I have to vote for it. And when you vote to take this nation to $14 trillion of debt, and you vote for a cyclonic effect of debt and stimulus money and public money, and then turn on 0 for 4 on a health care bill, adding to the debt, people losing benefits, costing more money out of pocket, endangering senior citizens that are on Medicare up to 50% according to Barack Obama's own White House. And you literally betray an entire district of people. I don't know what you call that. I don't know what you call it personally. I don't call it conservative. I don't call it blue dog. I call it betrayal. I call it stand up and being congressman. Stand up for the 12 counties that you represent. And I think it's an outrage. I think what he's done is catastrophic.